back pain. The strong risk factors, interestingly, the strongest risk factor has been a previous history of back pain. Poor job satisfaction, emotional stress, everything under the sky has been ascribed to complicating or aggravating back pain. And what are the tools that are available to us? Typically, the history, physical examination, relevant non-imaging investigations, and imaging. You have heard a very good talk on imaging by the previous speakers, so we may not dwell too much on that. The assessment requires the following and examination, and if any of these are present, these are high-risk patients and need to be evaluated with more vigor. Look for the presence of other causes of back pain, particularly osteoporotic fracture or malignancy in a younger patient might result in a fracture of the spine. So look for myeloma, prostate and breast in elderly patients. Local tenderness will indicate bone pathology, and although
the count, the disease activity score, DAS-28 or HAC or EULAR, their guidelines for assessing the patients who come to your clinic to assess whether they are active or they are in remission. So today our trial is the study on rituximab, and we were interested in rituximab as compared to other biologics because it's less expensive. It is like half the price of anti-TNFs, and also because, as we say, that it is basically a B cell, a CD positive, an antibody which is directed against the CD positive B cells, and the risk of having tuberculosis, which is more in our country, we desired that we should have a biologic in which the risk of tuberculosis is less as compared to other biologic agents. So basically, as you see here, that this is a murine antibody and a human antibody, which is IgG derived, and this is the murine component, and this is the human component. Now, how does it act? It is an appropriate B cell antigen. CD20 is an antigen which is not expressed on the stem cells, on early pre-B cells, on dendritic cells or plasma cells. And this is very clearly shown over here, that the CD20 antigen against which this antibody is directed is not expressed on the stem cells, and it is not expressed on the plasma cells and not on the pro-B cells. And this explains the mechanism of action of this, because you basically do not lose the capacity to mount an immune response if you would knock out all cell lines, including the plasma cells. So how does it act? It binds to the B cell surface of the CD20 antigen, and then the human derived region activates a cellular mechanism which initiates the B cell depletion. And we clearly know now that B cells have a role in rheumatoid arthritis. So by these mechanisms, you can lead to B cell depletion. And how does that work? It is by complement mediated cytotoxicity, cell mediated toxicity, and apoptosis. So what happens is, how does it deplete the B cells? By binding to the B cells, it activates the complement system, and when the complement system is activated, it leads to the lysis of the B cells by forming these pores in the membrane. So the other action is